Hey guys, this is my first Zoom, so I hope everything goes smoothly. I am actually going to be recording this and then sending it out to everyone. And so this is a recording a little bit early because I just wanted to kind of run through Zoom, make sure I understood how to do it. So what that means is we're not going to be able to interact live with chat with this specific recording, but if if you have questions, I want you to either send those, email us on that little sheet that told you about this talk. There's an email that you can send it to, and it's ghwc.generations@gmail.com. ghwc.generations@gmail.com. You can send any questions you have there, and I will answer those. And I'm also planning on to follow up with any questions and also follow up with some other things that we want to share with you guys on Facebook later throughout the month and throughout into next month. So I'm gonna go ahead and pull this up and get the screen share going here. Let me get this started. So this is a big topic, Immunity 101. Huge topic right now. My goodness, with everything going on with COVID, I couldn't think of a better thing to talk about than this right now. And so we're gonna dive into this. Here's the 5 things that we're gonna learn today, and 5 things that we're gonna go over. Because I will tell you that your immune system is a very complicated system, but there's a lot of simple things that we all can do to help improve our immune system, because there's a lot of serious problems that could happen from a weakened immune system. So number 1, the first thing we're going to talk about is what makes up your immune system and how it works. Number 2, we're going to talk about non-negotiable nutrients that build immunity. We're also going to talk about 5 immune-destroying foods that you should avoid. And then 3 simple lifestyle changes that will skyrocket your immunity. And also, I'm going to talk about a missing link to a titanium immune system that most doctors don't even know about. A lot of times, most medical doctors will not talk about this. A lot of nurse practitioners will not share this information with you. And so we're going to dive into that. So why am I here? I think the biggest reason why I wanted to do this is to share with you guys the idea of holistic health, because the more we can start to think in a holistic manner, think big picture, the better off we're going to be. Because I've always told people this, I believe chiropractic is so important because chiropractic helps to make sure your spine, your nervous system, and your posture are all healthy. And that is directly linked to the health of your immune system, the health of your digestion, the health of your whole body. And so it also matters, though, how well your diet is. What are you eating? What kind of things are you consuming on a regular basis? It also matters what type of exercise habits you have. Also matters how you handle and manage stress. It also matters if you are connected with nature. We need to get connected with nature because nature is so important to keep us healthy. We've been connected throughout our entire existence of our species. It hasn't been until the last, 50 or 100 years where we're really starting to disconnect. We need to get back to that connection, especially if you have good, healthy soils around you. So if we start to think holistically, if we start to implement a holistic lifestyle approach, you can start to get amazing results as far as your health is concerned. So that's why I'm here. That's why I'm here to share this information, because I want you to start thinking holistically. And so what is the immune system? How does it work? The immune system is an interactive network of organs, cells, and proteins that protect the body from viruses and bacteria or any foreign substances. The immune system works to neutralize and remove pathogens like bacteria, viruses, parasites, and fungus that enter the body. So, many of you know that we also do lab work in our office. And one simple test that we can do for blood work is looking at something called a CBC with differential. So that'll give us your white blood cell count, if your white blood cells are high or low, if they're in the normal range. But it also helps us understand what percentages of different white blood cells you have. So you have things like neutrophils, lymphocytes, eosinophils, basophils, monocytes. So there's a lot of different immune cells, and these immune cells help to attack viruses, bacteria, parasites, and fungus. But another thing that's important for our immune system, immune cells can also help to attack cancer cells. So these immune cells are, white blood cells are throughout our whole body, throughout our blood, but a lot of them are also in the tissues. So in our brain, we have certain immune cells in our brain, in our gut, which is where most of our immune system is. We have something called gut-associated lymphoid tissue in our gut. We also have immune cells in our liver, in our lungs, so they're spread throughout the body. And so really, again, thinking holistically, we want to help support the immune system so it can do its job. So it can help fight off cancer cells, so it can help fight off viruses and bacteria. And so one thing that's interesting in our society, you see down on the bottom of this screen here, it says the standard immunity solution in our society is to take pills. We take antibiotics for everything. We're taking steroids for all kinds of things. There's so many things that we just want to rely on a pill. But I want you to start thinking about how can we support the body, because the body was designed and created to heal. And it was wired to heal. And we just have to give it the right things, the things it needs, and keep the bad things away from it. And it will heal, it will start to heal itself. Now, sometimes people think, well, hey, when you're eating healthy food, when you're exercising, meditating, practicing yoga and stretching, exercising, when you're doing all of these things right, you should never, ever be sick. And I think that is a false belief set to have. Yes, once you start to implement more and more good, healthy things into your life, illnesses and sicknesses will drop tremendously and you'll have more energy and you'll feel so much better. But the thing that we want to have happen is we want our immune system to respond appropriately to whatever those foreign invaders are. And so we don't want our immune system to go rogue and go haywire where it turns into things like autoimmune disease where your immune system's attacking your own body and your own cells. But it's also concerning when you hear someone say, I never get sick. I haven't been sick in 30 years. I just never, ever, ever get sick. That's also slightly concerning as well, because if our immune system's so depressed and you never respond to the viruses and bacteria and things that we're exposed to all the time, and you never have a runny nose, you never have a cough, you never have maybe diarrhea or throwing up, you never have a fever, that's a little bit concerning because that person oftentimes is down the path of having cancer develop in their body. So if your immune system's so weak and you don't respond to anything, then you're not even responding to cancer cells in your body. So I want you to think of this for a second. Fevers are your body's natural way to fight a lot of these things off. So when your body develops a fever, so you go up to 99 degrees, to 100 degrees, 101, that fever, your immune system, those white blood cells in your body actually work better and more efficiently at a higher temperature. So your body realizes and recognizes that there is a infection or a bacteria, virus, a foreign invader inside your body. So it ramps up your immune system and it ramps up your temperature so your immune system can start to attack. Also, a lot of viruses and bacteria, they have a range of temperature that they can function more optimally in. And so when your body raises the temperature, a lot of times they can't function as well in that higher temperature. So that is a advantage for your immune system and a disadvantage for a lot of foreign invaders. And so in our society, though, again, we think about having a pill for everything. We want to lower that fever as soon as it gets to 99 or as soon as it gets to 100. One thing we encourage patients to do is if you have a low fever, say it's around 99 or 100, a lot of times what we'll do is we'll try to warm up a little bit. So we might have, if you're an adult, we might put blankets on you, or we might get in a hot shower, a hot bath, and warm it up. If you're a child, don't warm it up too fast, because you can actually have something, because they're so small, if you put them in a hot bath, it can raise their temperature so much they can actually have a febrile seizure. But you want to still, for a child, you can warm them up, have a nice blanket on them, and keep them comfortable. That will, again, strengthen the immune system, help your immune cells fight stronger, fight better to fight off that foreign invader. Now, again, we think of diarrhea and throwing up, and yeah, those are not fun. They're never pleasant. And there is a limit. You don't want to be having those things happen for you for days on end, because then you can get into severe dehydration and severe problems. But staying well hydrated and having some diarrhea and having vomiting is actually, again, your body's way of getting things out. A runny nose, a cough, your body's way of getting these things out. So we don't always want to suppress how the body is responding and trying to get these things out of us. we want to support. We want to support the body, help the body, and allow the body to get those things out of us. So what do I do? So this is, again, I might be sharing a new concept with you guys, because I think most of you have heard, taking vitamin D, vitamin C, zinc. We're all hearing about those things right now, especially with COVID. Those things are so important to help strengthen your immune system. Those are nutrients that your immune system absolutely needs for it to be strong. But a different concept that I'm going to be sharing with you guys as we go further into this talk is, how does the nervous system relate to your immune system? How does the endocrine system or your hormonal system relate to the nervous system? How does that relate to the immune system? And so something that's fascinating to me is, with all the information out there, it's hard to know what to do. And so where do I start? One thing that's interesting is, you look at this. This is a baby in utero. And look at that. It's 6 weeks into it. You see that going right down the back? That's the nervous system starting to form. That's the brain and spinal cord starting to form as early as 6 weeks in utero. And I tell you that because that's before any other organs or systems are developed in your body. That's really the nervous system has been called the master coordinator and the master organizer and conductor of everything in your body. So if we can help understand kind of how the body develops, also help understand how to keep our nervous system in balance, that's a really big key to keeping your body and your immune system strong and healthy. So how does the body heal? A lot of times we'll put Band-Aids on, we'll put this cast on. Did the cast heal you? Did the ointment heal you? Did the Band-Aid heal you? But really understanding this concept, again, this is going back to thinking holistically and thinking from a wellness mindset. The body heals from within. So you have wound healing that's happening. All these things are happening. You have these physiological stages of healing that you develop the scab, and then over time, everything starts to heal within, and then the body heals with a broken bone. Yes, we're grateful for that cast. We're grateful for the Band-Aid even, but we're grateful for that cast so you're not going to cause further injury or further trauma to that fracture. But really, the healing starts to happen with inside. So you have this bony callus that starts to form, and then the bone will start to grow together. So healing happens from within the body. Let's support the body. Here's some different symptoms that can happen from poor immunity. Someone's immune system's off. It could have allergies, could have IBS, or which is also called irritable bowel syndrome, celiac disease, asthma, ear infections, autoimmune disease, low energy, weight gain, skin problems, eczema. You can go down this whole list. You could even add cancer on this list. But these are different signs and symptoms that there's something off with your immune system. So the nervous system, we just mentioned this. I just introduced this just a second ago. The nervous system, think of this as the control center for immunity. It's a control center for a lot of the functions throughout your entire body. I like this quote here on the side. This is Dr. Bruce Lipton, which, by the way, Dr. Bruce Lipton has a lot of wonderful information. He has some wonderful books out there I really encourage you to read and get into. He is an expert in something called epigenetics, which means you can change the expression of your genes through your lifestyle. He's a cell biologist, and his stuff on YouTube, online is just incredible. It's absolutely incredible. But he said this right here. He said the function of the nervous system, again, your brain and spinal cord, the nerves going throughout your body, the function of the nervous system is to perceive the environment and coordinate the behavior of all cells, all other cells in the body. So if you look at this little chart over here, you have different life events. Might be buying a new house, might be having a wedding, new baby, new jobs, lose a job. So there's a lot of different things that are happening in our world. And your nervous system is taking all that information in. It's also taking information in from the food we eat, whether we exercise or we don't exercise. It's receiving information every single second that we're alive. And your nervous system job is to be able to perceive that information and be able to respond according to, that information, is it a threat to our life? Do we need to go into fight or flight or survival? Or is this all good information, good things that our brain is receiving? And is it something that our brain nervous system can put us into rest and relaxation? Some of you might have heard this. There's part of your autonomic nervous system called sympathetic nervous system, which is fight or flight. And the other part of the nervous system, which is called parasympathetic nervous system, which puts us into rest and digest. and relaxation. We need both sides of our nervous system. You need that fight or flight nervous system in order to survive. Maybe you're driving down the road and you're in a car and there's oncoming traffic, and maybe a car starts to drift over in your lane. You need to respond in that instant. You need to be able to respond in a fight or flight way so that you can respond to get out of the way. So for survival, thank you for a fight or flight system, but we also need rest and relaxation, digestion, healing, growth, and repair side, that parasympathetic side. And we really want to be more dominant. We go to this next slide here. We want to be rest dominant, and we do not want to be fight or flight dominant. See, in rest dominant, health and recovery is the #1 priority. You increase the digestion in your body. It balances out your hormones. You're able to sleep better. When we're in that fight or flight dominant side, that sympathetic dominance, survival is the #1 key. You have increased blood pressure, increased stress hormones, increased pain, increased inflammation, increased heart rate and blood pressure. Staying in that fight or flight side over time, chronically, over many, many days, months, years, it drives you towards every chronic illness known to man. Heart disease, diabetes, obesity, but also think about this for your immune system. Chronic stress weakens your immune system. It weakens it. So it increases your chance for every one of those chronic illnesses that we talked about, all of those symptoms we talked about earlier. Cancer is another issue. We want to move out of that fight or flight dominant state and go into that rest and digest state. So let's talk about some keys. There's some keys that you're going to be able to do at home for sure. There's 5 keys to supporting the nervous system to boost your immune system, to strengthen and restore your immune system. Here's some things that we absolutely want to avoid. These things, these foods wreck your immune system, wreck it. Sugars, maybe, well, these are also important, but this might be the most important thing. Right now, if you drink 1 can of Coke, the amount of sugar that's in a soda will suppress your immune system, shut down your immune system for 3 to 6 hours after that drink. 3 to 6 hours. Here's the reason why. On our white blood cells, they have these little receptors that stick out. Those receptors, vitamin C will bind to those, and vitamin C is an important nutrient to help support your white blood cells and support your immune system. Sugar has a very similar structure to vitamin C. So if you're having a lot of sugar, your sugar is actually binding to all of those receptors that vitamin C is supposed to bind to, and it shuts down the function of your white blood cells. So 1 can of Coke, you can have 3 to 6 hours of your immune system being suppressed. How many people are drinking sodas all day long? All day long. And so let's talk about some other things where sugars come from. Grains. Eating a lot of breads and pastas and pizzas, there's one chemical reaction that happens in your body that turns grains into sugar. So grains, in fact, grains is one thing that, especially bread, is one thing, wheat is one thing that increases your blood sugar and keeps your blood sugar high more than most anything else. And so we want to try to minimize and decrease the amount of grains, the packaged food, the refined carbohydrates, again, the breads, pastas, cakes, crackers, donuts, soda, all of those things suppress your immune system. Artificial sweeteners. Artificial sweeteners, there's a book called Excitotoxins. It's all about artificial sweeteners. Artificial sweeteners destroy your brain cells. They also screw up your blood sugar. I know a lot of people that have had diabetes, they've been told to start to do Diet Cokes, Diet Pepsis, Diet all of these things, and go with the 0 carbs. Whenever it says 0 carbs in it, that means a lot of times it means they're adding artificial sweeteners. Artificial sweeteners, high fructose corn syrup, sweet and low Splenda, all these things can absolutely wreck your blood sugar. Do not do artificial sweeteners. Hydrogenated oils, canola oil, vegetable oil, soybean oil, corn oil, frozen microwave foods, potato chips, french fries, fried foods. These oils are so bad for your brain. Our brain is about 60 to 70% fat. Most of that fat is the omega-3 fatty acids. And so omega-3 fatty acids come in things like flaxseed, chia seed, cold water fish, especially cold water fish, but also in things like grass-fed meats. And so those are really good fats for our brain. But these oils supply poor building blocks and materials for your brain. Really, really bad for your brain. So stay away from hydrogenated oils. Now switching over to like coconut oil, olive oil, those types of oils are going to be really, really helpful. Stay away from fried foods. Fried foods is a major cause of inflammation. Inflammation can really screw up your whole immune system. And again, soda. I'm also going to add to this a lot of frozen fruit juices. You have to be very careful. A lot of frozen fruit juices, like having orange juice and you buy it frozen, there's a lot of sugars that are added to that. And so be very careful with those things. Sugar, again, a major no-no for your immune system. I'm going to back up here. Let's talk about this. Cancer, a lot of cancers feed on glucose, on sugar. So again, if you're wanting to speed up the rate at which cancer is growing in someone's body, then give them all the sugar they want. But if you're wanting to hopefully slow down the rate at which that's growing, then you want to try to minimize the amount of sugars. Because again, cancer feeds sugar. A lot of times when they're doing certain diagnostic imaging to detect where cancer is in the body, they'll give you what's called radioactive glucose. Radioactive glucose. So glucose is sugar. That sugar has a radioactive isotope on it. And so when you swallow that radioactive glucose, it goes into your body, you absorb it into your bloodstream, the cancer loves sugar so much, it's going to suck that sugar up. And then when you take an image of it, you can see all of that radioactive isotopes right where the cancer is, because cancer is sucking up the glucose. So 5 immune building nutrients. How many of you growing up, when you had a cold or a flu, maybe you had chicken pox or measles when you were a kid, how many of you had chicken noodle soup that your mom made you when you're at home? Well, guess what? It wasn't the noodles, it wasn't as much the chicken, but it was the bone broth and the chicken broth that you had. That is so healing for your immune system. It has type 1, type 2 collagen, good for your joints, good for your gut. It has glucosamine, chondroitin sulfate. It's just so good for the immune system. So bone broth is absolutely essential. And that's something we take on a regular basis to help strengthen our immune system. You also want to switch those bad fats in the last one we talked about to good fats. So coconut oil, avocado oil, olives, avocados, dark chocolate. You want to have these different types of fats in your diet. These really help to support your immune system, support your body. And yes, I did say dark chocolate. So I like dark chocolate around 85 or 90%. Dark chocolate has some really good fats in it, but also another great thing that dark chocolate has in it is magnesium, which magnesium is really good for helping to relax your mind and relax your body, to put you into that parasympathetic, that rest and digest state. So it's very helpful for that. Probiotics-rich foods, sauerkraut, kimchi, and kombucha. Now, one thing that's amazing about sauerkraut has a lot of beneficial bacteria. It could have 6, 7, or 800 different strains of bacteria in live raw sauerkraut. That's the best thing for your gut, because in your gut you have probably thousands of different strains of bacteria. We want to support your immune system in your gut. Again, most of our immune system is in our gut, and so we want to give good bacteria in your gut. But here's what's cool about sauerkraut. In 1 cup, 1 measuring cup of sauerkraut, raw sauerkraut, you're going to have roughly 700 milligrams of vitamin C. And we all know, again, vitamin C binds to those receptors on the white blood cell, helps your immune system. It strengthens your immune system. So sauerkraut is something, if we start to feel a tickle in our throat, we start to have a cough, we have those symptoms, instead of suppressing those things, instead of trying to take something to lower your fever, trying to shut off the cough or shut off the runny nose, we'll sip on sauerkraut juice throughout the day. And a lot of times, by the end of that day, that sniffle, that cough, that sore, whatever it is, a lot of times it's gone. You're getting tons of bacteria and tons of vitamin C. Clean protein. Clean protein is so important for your immune system. Wild caught fish, grass-fed beef, free-range eggs and chicken. These have so many nutrients in them. A lot of times we do a lot of organ meats as well. Organ meats really is where most nutrition, it's more nutrient dense than any other vegetable for sure, is if you can get good organic grass-fed organ meats, super healthy for your body. And again, they have healthy fats, which is so important for your brain. So some supplements that we take is probiotic supplements. We also recommend vitamin D, and of course, getting plenty of water and hydration. Something I will go through later, probably on Facebook, is specific supplements. Like we also add in some vitamin C, vitamin D, and zinc, specific supplements for immune system to help prevent different types of infections, but also specific supplements for the immune system. If you come down with something, what can you do to really help go strong at it to help bring your body back to health? So those are things we'll follow up with later on Facebook. My goodness, this is a key right here. Move your body, sweat it out. It's so important. So here it has a picture of someone walking, running. HIIT stands for high intensity interval training. Also resistance exercise. I'm going to throw in here exercise with yoga and Pilates. Good. It's good if you're doing one thing. It's better to do, multiple things, but the best thing is if you can have a total variety of exercises that you do. We want you to be able to have resistance in exercises where you're doing maybe body weight exercises, or maybe you're lifting with weights. That's going to build strong bones, strong muscles. That's going to build strong tendons. You can actually reverse osteoporosis with that, but you also want to make sure you're going on those long hikes for endurance. You're walking and you're running for endurance. These are so helpful. Whenever I look at someone's lab work, whenever I'm looking at complete metabolic panel or complete blood cell count, or doesn't matter what I'm looking at for labs, one thing that I can always recommend is that if you're not getting the appropriate amount of exercise, not too little, you don't want too little, you also don't want too much, because you can overtrain too. You're not getting the appropriate amount of exercise. That's something that I can recommend for patients that every single person's going to benefit from, and your labs will improve with this recommendation as well. So one thing we know for sure with your immune system, it requires movement. You have to move your body. So something that might be helpful for people is maybe having a personal trainer watch you to make sure you have the right form, because if you don't have the right form, you can actually do harm to yourself and hurt yourself. So having the right form is essential, but that's where things like a trainer can be so helpful for you. So let's go to the next one. I love this one. And if you've been in the office, the last, 9, 10 months, you've probably heard me talk about deep breathing exercises. I'm going to recommend a book for all of you right now. It's called Breath by James Nestor. Breath by James Nestor. In fact, it's a really good audio book. It goes through different breathing techniques and the power that has on your immune system, the power that it has on your overall health of your whole body. So important. And so gratitude, having a mindset of gratitude, is so helpful to get you out of fight or flight, that sympathetic drive of the nervous system, and move you into parasympathetic stimulation, rest and digest. And so gratitude is so essential. So this is a group exercise we're going to do. And this is one thing I want you to think about too. This would be even better, even bonus on top of this bonus. If you can do this simple exercise on a regular daily basis, but if you can take this exercise outside in your yard, take your shoes off, you're barefoot. I want you to put your feet on the grass or on the dirt, as long as you are not spraying chemicals on your lawn. If you are, we need to start to switch out of spraying chemicals and start to do a more organic yard. You can do it. It's going to be more healthy for your yard, your body, and everything else. But if you can get to where you can put your feet barefoot on the grass or on the dirt, focus on the things you're grateful for. And then the breathing exercise that I love to recommend that stimulates that rest and digest, that growth, healing, and repair side of your nervous system is called a 4-4-8 breathing. So you're going to inhale slowly, deep inhalation for 4 seconds. You're going to hold that for 4 seconds. And then you slowly exhale for 8 seconds. So I'm going to go through a couple cycles of that with you. And here's another key to this. Close your mouth. Do it all through your nose. Your nose filters the air. It moistens the air. And when you breathe through your nose, you release something called nitric oxide. That helps with vasodilation, so it helps with circulation throughout your entire body. So we're going to do breathing through our nose. We're going to do 4-4-8 breathing cycle. And again, if you can get outside and do this barefoot on the grass, that's the best place to do this. So I'm going to put my finger up when we're going up. I'm going to do this when we're holding. I'm going to put my finger down when we're exhaling and let all the air out. So here we go. Breathe in through your nose. That is such an awesome breathing technique. We just did 3 cycles of our breath. You should notice after you do 5, 10, 15 cycles of your breath that you feel so much more relaxed. Again, if you can be grounded while you're doing it, outside, barefoot, that's even better. But focus on the things that you're grateful for while you're breathing. That should be something that is a regular habit for every single one of us. That's going to strengthen our immune system in our body, for certain. Now, here, let's talk about this. Because where does, remember in the beginning we talked about, I'm sharing all this information because I want us all to start thinking holistically. It's not okay for you just to get adjusted on a regular basis and think that you're going to be healthy and everything's going to be totally fine. You also need to exercise. You need to have good nutrition. You need to have good breathing techniques and meditation, relaxation techniques. You need to do all these holistic lifestyle things. But if you're doing all those things and your spine's not healthy, then you are not going to be as healthy and as well as you can be. So here's a great quote. It says, the brain requires feedback from the spine through proper alignment and motion in order to deliver the right information to all the muscles, organ, and tissues of the body. So here's what happens. When everything's aligned, your posture's healthy, your body's moving healthy, that sends a healthy stimulation to your brain. It charges your brain up. Then your brain now sends signals back down the spinal cord, out the nerves, to out our whole body, to all of the organs and systems in our body, even our immune system. And that helps deliver the proper function, coordination throughout our whole body. It's absolutely essential to keeping our body healthy and strong. Here's a good point right here. Why is the spine so important? This is Christopher Reeves. Many of you probably know. I'm going to remind you of his story here. The spine protects and directs your nervous system. So we have these hard bones along the spinal cord. They help to protect your nervous system, but proper motion of those bones, proper alignment, helps to direct and drive energy to your brain. A lot of you notice this. If you have times where you're not thinking clearly, or maybe you have a brain fog, or you're really stressed out, you know that if you go for a walk, when you come back from that walk, oftentimes you can think clear, you can handle stress better. Movement drives healthy stimulation. Not going to get too detailed on the neurology of it. I can get really detailed on that if you want that later. But movement drives healthy stimulation to your brain, and then your brain sends signals and helps the whole body. So let's talk about this situation here with Christopher Reeves. So we know he was Superman, and he was actually in a horse show where they're doing jumps with a horse, doing horseback riding, and he actually fell off and he broke the first 2 vertebrae in the neck, C1 and C2. There's a fracture in the vertebra. Now, this did not sever or cut his spinal cord. What happened was the surgeon said, I put this point up here with that little pinky there. The surgeon said that he had an injury to his spinal cord the size of the tip of your pinky. It basically went in and bruised the spinal cord. And so think about what happened with him. Yes, that is a major trauma. That's a major trauma for certain. But because of that, he instantly was not able to breathe. He's had to live the last 10 years of his life, he had to live on a ventilator after that accident. And they said in the last 10 years of his life, he aged 25 years or more in the last 10 years of his life because it was such a major stress to his nervous system. And something that's also interesting, he had to have therapists help to massage his colon to help him have bowel movements. His organs were not functioning as well. And so again, stress, the nervous system really controls the body, and damage to the nervous system affects the entire body. And so our spine protects and helps direct the nervous system. And there's something called a subluxation. If you're a patient here, you've heard this term. Subluxation is where the vertebrae in the spine are misaligned, or they could be in alignment, but they're just not moving properly. For your joints to be healthy, the joints in your elbow, the joints in any joint in your spine, they have to have proper alignment and proper motion. So what a subluxation is, it's an interference in the brain and the nervous system from a spinal vertebra not aligned or moving appropriately. And that, ladies and gentlemen, that puts stress on your spinal cord, puts stress on your brain, puts stress on your nervous system. And so that subluxation, what happens, we go back to this slide here. Again, we're okay. We want that fight or flight system for survival, but we also want to be preferred. We want to be in this parasympathetic, this rest, relaxation, growth, healing, repair side of our nervous system. But if we have a subluxation in our spine, in our vertebra, that's causing a stress on your body, that puts our body into fight or flight. It is a stressor, a physical stressor on your body. And that's causing you to release more stress hormones. And again, we go back to increased blood pressure, increased stress hormones, increased pain in our body, increased inflammation. The inflammation happens because your body is not, the joints are not moving properly, so it becomes inflamed. You start to have arthritis and degeneration down the road. But this is a stress on your brain and on your nervous system, and this is a stress that puts you more into fight or flight. This is from the American Journal of Pain Management. This is a scientific journal. It says the spine and posture affect and moderate every physiological function from breathing to hormone production. So everything is moderated and affected by your spine and your posture. Let's go to this next one here. Again, a subluxation interferes with that because it puts a stress on your spine and on your nervous system. When your spine is out of alignment, when your spine is not moving properly, your nervous system is not fully able to focus on maintaining a strong immunity, AKA the bear stays in the room. So you have this stress. Remember, our brain, our nervous system is receiving all this information from our external world, but it's also receiving constant information from our internal world. And if you have this stress signals going to your brain because your spine is subluxated, then that is a stressor that puts your nervous system into fight or flight. So if a bear is in the room, do you think your body could fully focus on proper digestion? So think about that for a second. If an actual bear came into a room right now, all of the blood going to your intestines and to your vital organs inside your body, like this picture shows, the blood actually, it's something called vasoconstriction. The blood actually decreases to all of your vital organs because you're not worried about digesting your salad that you had for lunch or digesting your breakfast. You're not worried about those things right now. You need all of that blood to go out to your muscles or to your brain so you can fight that bear or so you can run from that bear. So for survival, your body, when it's in fight or flight, it shuts down your digestion. This is interesting, and this is a personal story for me as well. I think I've told most of you that the main reason why I'm a chiropractor today is because of how I used to get really bad headaches. So I'm really passionate about helping people with headaches. But another thing that I used to get, and sometimes every once in a while I'll still get, is in the middle of my back, the 6th and 7th thoracic vertebra. I think playing football with my brothers or playing football in 7th grade, there was a time when I had an injury there. That area of my spine became subluxated. That started sending stress signals to my brain. My back would hurt. And then that would send signals out. The nerves in that area go straight to my stomach. Now, when my back is subluxated, when it's misaligned, not moving properly, it's like someone puts a knife straight through and my stomach starts to ache. It starts to cramp up. It starts to be painful. For those of you that know my wife and I, we have dialed in our diet over the last 15 years to a really good level, really healthy level. And so it's something that we've worked on for many years. Your stomach can also, I bring that up because your stomach can also be upset from eating a bad meal. Your stomach can also be upset if you have a lot of stress. A lot of you guys have heard people say, I'm so stressed out, my stomach's in knots, right? So mental stress can cause your stomach to be upset as well. But for me, because we've worked on those things, improved those things over the years, 9 times out of 10, if my stomach is upset, it's because my back is subluxated. And that subluxation is affecting the function of my organs. So when you go into fight or flight, your digestion is affected. Your quality of sleep is affected. Most of you know this. If you're stressed out, you can't sleep. Fight or flight, when your nervous system is in fight or flight, it affects your sleep. It affects your immune system. How many of you guys have know this? A great example of how it affects your immune system. This is a viral infection I'm going to talk about. Herpes virus. Herpes can cause fever blisters. So most of the time, the virus stays inside our body. It stays dormant in our body where it's not going to cause blisters all the time. Now, when your body gets really run down, when you get really stressed out, when your body's in this fight or flight state, what happens is, boom, that virus will come out, the fever blister will come out. So what happens when we're in fight or flight, when you're fighting that bear off, your body shuts down your immune system. And the reason why that's so important is because your immune system requires a lot of energy to run it. And so it's going to shut down your immune system because it says, I need all of that energy to fight this bear or to run for this bear. So for survival, we're glad that it shuts down our immune system. But the problem with that, again, the problem is things like cancer can come up. Things like different bacterial, viral, fungal, parasitic infections can all come up and have more problems in your body because you're in fight or flight. You're in a survival mode. Your whole immunity starts to get shut down when we have this chronic stressor on our body. And so let's talk about this. I kind of mentioned this, but you can have all of the best nutrition, exercise, and sleep. But if you are subluxated and that bear stays in the room because you have areas that are subluxated in your body, that's causing you to go into this sympathetic dominant state, this fight or flight dominant state, you're not going to be as healthy and as well as you could be. And here's the issue with this. A lot of times people think this is just only has to do with when you're hurting. That couldn't be farther from the truth. In fact, your joints in your spine, your body can become subluxated and not be painful at all. So a lot of people don't even ever get their spine checked or evaluated to know if they have this stress on their body because they think you only should go to a chiropractor when you hurt. And that's not true. You should get checked out. You should at least get your spine nervous system checked and evaluated to see if your posture is healthy, to see if your spine is aligned and moving properly. Because if you have that bear in the room, whether you have pain or you don't have pain, where you have that bear in your room, you're not going to be able to absorb the nutrients like you want. Your exercise is not going to be as effective. Your sleep is not going to be as well. Again, the bear stays in the room. So it affects all of those things. So here's some research to support this. The Journal of Manipulative and Physiological Therapeutics in 2006. This 2006 study showed a change in vagus nerve which is known as the CEO, quote, air quote, CEO of calm in the body. So the vagus nerve is the main nerve for the parasympathetic nervous system, rest and digest nervous system. There's ways you can measure that. We're actually just getting new technology in our office. It's already been ordered, but technology to help us measure the balance of your autonomic nervous system. Are you more in fight or flight? Or are you more in rest and digest? We're getting new technology to check that. It's called heart rate variability. But this study actually found that when they do adjustments, cortisol levels, stress hormone levels lower, because we're taking a stress off of your body, helping your joints move better, lowering that inflammation, decreasing pain, taking that stress off of your body, and that stimulates the vagus nerve, which helps your whole body heal and function better. In 2017, this is evidence-based comprehensive alternative medicine journal in 2017. This study utilized PET scan to show that an inhibition in the stressed sympathetic tone of the nervous system. So what they found in this one, they did adjustments, and this one is patients with no pain at all, no pain. So these people were coming in to get adjusted. They didn't have pain. They got adjusted because they found areas that were subluxated, that were not aligned or moving properly. And they found that it decreased the sympathetic nervous system, stress hormones lowered. I'm gonna go to some more. This is a Journal of Osteopathic Association. Spinal adjustments increase secretory IgA by 139%. That is an antibody. A lot of times we hear about, like with vaccines, they talk about how it's causing you to produce antibodies. Well, your body produces them on your own. Let's support your body and help your body produce those antibodies on your own. The adjustment increased secretory IgA, which is the antibodies in your gut, in your lungs, in your throat, in your sinuses, by 139%, increasing immunity and decreasing risk of infection. That's a big deal. That's from adjustments. 98% of patients with dermatitis, allergies, and asthma had vertebral, which is spinal misalignments. Again, we have to think holistically. Yes, the nutrition is important. Yes, the exercise is important. Yes, the breathing techniques and meditation is important. But we have to make sure our spine, our body is healthy. Those who received an adjustment had significantly higher IgM and IgG levels post-adjustment compared to control groups. This, again, these are two other antibodies in your blood. IgM is the most abundant antibody in the blood, but these are increased with adjustments. And it makes sense if you know how the adjustments take stress off of the body, restores healthy stimulation to the brain, and that puts you into that parasympathetic rest and digest state. So again, here are the poor symptoms, or symptoms of poor immunity. And I want to say this, it's not that when we're talking about doing adjustments to strengthen your immune system, or avoiding certain foods, or adding in certain nutrients, or breathing techniques, relaxation techniques, it's not about treating any one of these symptoms. What it is about giving the body what it needs to heal and to function properly, to get us out of that sympathetic dominant state, fight or flight state, survival state, and to get us in that healing, rest and digest state. And then these things, really cool, they start to improve. So how do you test for nervous system dysfunction? This x-ray, my gosh, if you're a patient, you understand this right now, just by looking at this x-ray. This spine has a lot of stress. And this patient, when they came in, had no pain in their neck. But there is a lot of stress in this neck. We should have a good curve that goes forward in the spine. The spine should have good alignment. But here's ways that we test for it. We always look at range of motion. With range of motion, you want to make sure that there's symmetry from side to side. Make sure that the spine can turn and bend in the same manner from side to side. Again, we want symmetry. With palpation, when we feel the spine, we want to feel that everything's aligned properly. We want to feel that everything's moving properly. We want symmetry from side to side. It's so common for people to say, oh, I can turn really good this way, but I can't turn as well this way. or maybe just their whole range of motion, both direction is limited. How many times have you guys seen people, in order for them to turn to look behind them, they have to turn their whole body to look behind them? Their range of motion is shot, and that's causing a lot of stress on their spine and on their nervous system. Just like this picture is over here, X-rays is a way that we test for nervous system dysfunction, because it's a way that we can see where the alignment's broken down and give you proper recommendations to correct it. HRV, heart rate variability. Now this is new for our office, but we just ordered this technology. This is something that helps show us where are we at with our nervous system balance. Are we in fight or flight? Are we in rest and digest? And then also posture evaluation. When you look at someone's posture, you want their shoulders to be level, spine to be straight up and down. When you look at the side, you want the ears to be over the shoulders, over the hips, over the knees, over the ankles. So common, it's so common for people's posture. You might look at someone that might have one shoulder higher. That's a really strong indicator that that person has scoliosis in their spine, which is a side curvature of spine. But I'll tell you, the most common postural deviation and postural stress that we have today is forward head posture. Why do you think that is? Why do you think so many people have forward head posture? The biggest reasons is our modern conveniences and our devices that we have. Our cell phones, in the research, they're calling it text neck. The average position that we have while we're looking at our phone is 45 degrees of forward flexion in our neck. That adds 60 additional pounds of weight and stress to our neck and our upper back, which is a major cause for neck pain, headaches, all kinds of issues. So that is the most common thing that we see, is our head is shifted forward, and that is linked to major nervous system dysfunction and major problems, even if that person doesn't have neck pain or problems. Take a look at this. This is American Journal of Pain Management. They said, this is posture predicts longevity. Your posture predicts longevity and mortality. There's also the Journal of Spine, Journal of Gerontology. There's 4 other peer-reviewed journals I'm thinking of right now that show that as our head comes forward, as our upper back starts to round, starts to develop that hunchback, or what's called a Dallinger hump, which is a smaller hunchback, they actually found that as our posture gets worse, it puts more and more stress on the body. You are less likely to perform activities of daily living. So whether that be taking care of yourself, mowing the yard, whether that be bathing, whether that be eating, feeding, the more your posture is fading, the farther it fails, the more difficult it is to perform all activities of daily living. Whoa, that was a nice Southern accent. All activities of daily living. Nice. But so as our posture fails, though, it affects all of those things. They also found that your lung volume, your ability to breathe in, is affected. You can't breathe as well. Your chances of dying of lung problems in the group that has really bad hunchback versus someone who has healthy erect posture is 2 times greater. And their chances of dying of atherosclerosis, heart disease of the major arteries, is 2.4 times greater in people with really bad posture versus people with healthy posture. So let's look at what this one says. Posture affects and moderates every physiological function, from breathing to nervous system function. And despite the considerable evidence that posture affects physiology and function, the significant influence of posture on health is not addressed by most physicians. This is why I was telling you earlier, this type of information is things that you're not going to hear from maybe your uncle that's a medical doctor, or your neighbor that's a nurse practitioner. It's important that we look at the whole lifestyle, holistically speaking. We need a good nutrition, we need good exercise, we need good stress management techniques, breathing techniques, but we also need to pay attention to our posture, pay attention to alignment to keep us strong and healthy. A lot of times in our society, what we do is we turn, for our health, if we have any symptoms at all, we turn towards medicine for drugs and surgery. And I want all of you to know that I am extremely grateful for emergency medicine. Medicine, we're actually the best country in the world for emergency medicine. We absolutely are. But as far as our healthcare is concerned, medicine should have no part. Taking drugs has no part in getting us healthy. Having surgery is not something that gets us healthy. We need to look towards lifestyle. There are times and places for drugs and surgery, but if we're really wanting to restore our body, we need to think holistically. In the United States, we have roughly 5% of the world's population living in the United States. And we take over 75% of the world's medication. That would be okay if we are the healthiest country in the world. However, out of 39 industrialized countries, we rank 37th as far as our health and longevity is concerned. These different things I have here on the screen here, this is from the Journal of American Medical Association. What they said in their own journal, they said that they're the third leading cause of death, and that's from properly prescribed drugs. Properly prescribed drugs is the third leading cause of death. We know that every drug has side effects. Vaccines have side effects. Drugs have side effects. We know that these things, these medical tools have side effects. And it just so happens that one of those side effects can be death. And the third leading cause of death, according to this journal, Journal of American Medical Association, is properly prescribed medicine. But they also said that 44,000 to 98,000 Americans die every year due to medical error. They said that the benefits that U.S. healthcare currently delivers may not outweigh the harm it impairs. The incidence of serious and fatal adverse drug reactions in U.S. hospitals was found to be extremely high. I'm not telling you any of that to tell you never take drugs or surgery or have surgery. Because again, I'm grateful that we have emergency medicine and antibiotics and all of these different things. But if that's something that you or your family has been turning to all the time, day in, day out, every single month, every single year, and it's just not getting you healthier. Sometimes people think we're healthy because our blood numbers, our levels normalize because we stay on their medication. Well, what happens if you come off medication? Will those numbers go back out of range? Probably so. But if you start to address your lifestyle, which is at the root cause of most of these diseases and illnesses, we start to address our lifestyle choices, then we can see all those levels start to normalize, and we don't have to have the medication. We don't have to depend on that every single day. That's a big deal. Let me finish with this. I have 2 more slides left. This one's such an awesome testimonial. Just for patient confidentiality, we're going to say that's the L family, because this is a family of 4. Mom and dad, they're both in their upper 30s, and their kids. Their son was 9 years old, their daughter was 11 years old. This family came in as a whole family that they all got under consistent chiropractic care. And they stayed under consistent chiropractic care for an entire year. And then they stopped at the end of that year, and I didn't see them in the office for the next 6 months. When they came back into the office, I sat down with them to see how they've been doing. And they said the reason that they came back into the office is because while they were under care for that entire year, the whole family was not sick that whole year long. Prior to that, before they were patients, before they were getting regular care, when I say regular care, I think we started out at twice a week for some of them, and for the kids, I think we started once a week, but they all went down to like once a week or once every 2 weeks for an entire 12 months. And they said before they started getting adjusted, they were sick all the time. The whole family, they're just kind of a sickly family, and they had sinus infections on a regular basis. The stomach was upset on a regular basis. They would catch the cold and flu on a regular basis. They were just sick all the time. The whole year long, the family did not get sick at all. In those 6 months, that 6 months break they had, they said they started getting sick. But when they got back under care and got under regular care, again, their immune systems improved. Again, it's going back to that parasympathetic, sympathetic dominance. We weren't treating infections by doing adjustments. We were taking a physical stress off of the body, taking that bear off of their body. We're putting them more in that parasympathetic state, that rest and digest, and their immune system, the secretory IgA, those different antibodies, their immune system strengthened, and it helped them handle those infections naturally. Another common thing I get from patients on a regular basis is I had patients where they say, I used to get monthly sinus infections. Now that I've been to regular care, I don't get sinus infections at all. I have patients that come in when their allergies are flared up and they get adjusted and their allergies go away. I don't have an adjustment for allergies or for infections. Again, it's taking stress off the body. It's putting us in that rest and digest state. It's essential part, holistically, it's essential part to the nutrition, to the exercise, to the breathing techniques, to the meditation, all of those things, absolutely essential. This is such a cool case, and it's something that we hear all the time in our office. So let me finish with this. If you're watching this recording and you have not had your spine and nervous system checked, by all means, get your spine and nervous system checked. We can absolutely do this. And if you are a patient, listen, we've been in practice for 15 years. We don't do a lot of advertising. We don't do much at all. We are in practice because of our awesome patients sharing information like this with their family and with their friends. So I ask that you, if you know one person even, if you know one person that has immune system issues, or if they're having issues in their spine or their posture is off, spread this with them, because this could be something that could really help them just strengthen their body and take their immune system, take their health to the next level. I want to share with you the next topic, because I'm going to be doing this again next month. I'm going to continue to do these workshops. I used to do these a lot in person, but as you guys all know, that's really frowned upon now with all COVID restrictions. So I'm grateful for Zoom and grateful that we can do this recording. But the topic that I'm going to go over next month is your stress is killing you. Your stress is killing you. So again, we've touched on that a little bit today, but I'm going to dive in a little bit deeper next month, how this is so important. And one last follow-up is I don't like Facebook and I don't like Instagram. And in fact, I'd recommend that you guys really delete those things, get rid of them. But if you guys know of a better way that we can easily share different tips with you, please let us know. But right now, the easiest way that we know is to share tips on Facebook and Instagram about how to make broth yourself, how to make your own sauerkraut. We've done these things in the past, but we're going to continue to support you guys on proper exercises and stretching techniques, on broth and all these different things. We're going to continue to support you guys on Facebook and Instagram. So please connect with us there and we'll share that with you. But like I said, if you know of a better way to share that information without the crap that Facebook and Instagram have because of all their addictive algorithms and policies that they have, please share that with us too. But guys, listen, I'm going to wrap up now. You can send questions to us either by Facebook or you can send questions to us on that email address that I told you before, directly to the office. And I'll answer those either one-on-one with you or I'll answer them through Facebook and Instagram. But hey, I love you guys. I appreciate all of you. I hope you have a great day, and I'm going to close out from here. Stop the screen share. I'm stopping recording. Awesome. Have a great day, guys.